Hi, I'm Dr. Angela Faulconer. This is a short video about why studying medical ethics is a great choice. I hope you'll consider joining us next semester in Philosophy 212R. This video will feature reflections by recent BYU grads, reflections recorded in their dorm rooms, their kitchens, their studies, their laundry rooms, on why studying medical ethics is valuable. So, why take medical ethics? Because medical ethics deals with important questions. On this topic, we'll hear first from Brad Sears and then from Madison Harmer.
So many of the issues that come up in medical ethics implicate some of life's greatest ultimate questions. What kind of protections do we owe the unborn? When is it okay, if ever, to take a life? What kind of restraint should be placed on the autonomy we have in making decisions about our own bodies? And those are questions that we should at least try to answer, also because they're questions that cut to the heart of the human experience, and for that reason they're worth thinking about.
I think medical ethics is really important and useful for anyone to study. There's so much in the news and politics that has to do with medical ethics. It's an unavoidable part, I think, of being an informed member of society now.
While science and medicine tell us what we can do, moral philosophy, in this case medical ethics, helps us explore what we should do. Let's hear from Philip Crepeau.
With every new discovery that's made, the science of medicine keeps expanding. And as a physician, there are a growing number of things that I can do to treat a patient. But there needs to be some sort of guidelines to help me to know what I should do to treat patients.
Medical ethics gives us the tools we need to talk with others about their beliefs and our own. Let's hear once again from Brad Sears, and then we'll go to Daniel Chavez. And then we'll hear from Michael Morgan, and again from Madison Harmer.
I would recommend studying medical ethics because it gives you the tools you need to identify, refine, and defend your beliefs on a topic that is increasingly important and relevant. So many of the issues that come up in medical ethics implicate some of life's greatest ultimate questions. I realized just a few days into my first medical ethics course that I didn't have great answers for those questions, and the answers that I did have were somewhat underdeveloped. And progressing through the course helped me identify more solid reasons for the answers that I would give, reasons that might appeal to those who came from different social or religious backgrounds than I did. And it also helped me understand that these are complex issues, and there may be more than one way to answer these questions. It helped me sympathize with other points of view. So those are benefits that stick with me and make me really grateful that I studied medical ethics.
In my daily life as an attorney, I'm surrounded by people who are interested in discourse about topics that are related to medical ethics, even if it's just basic topics like abortion or things like that. And I find that because I took this class, I'm able to a lot better articulate why I feel a certain way about an issue. And it's been a great blessing in my life because you get in those conversations, and especially with the religious views that I have, sometimes those are hard to defend on other grounds if you haven't thought about them ahead of time. And going through this class made me talk about hard issues and come to an understanding of my beliefs on them and why I believe those things, and be able to defend them using reason. And that can be a powerful tool.
Is for me just testimony. The church will often take a stance on things like abortion, euthanasia, and due in large part to the medical ethics tech class I took in my undergrad with Dr. Faulconer, I feel like I can have a level-headed conversation about those issues.
And even if taking a course in medical ethics doesn't change any of your views, it will definitely make you more able to eloquently defend your own views and to form opinions about new problems and situations as they come forth.
Everyone is going to face these sorts of issues in their own lives and in the lives of their loved ones. So let's hear again from Michael Morgan and then from Kai Lavelle.
The issues we talk about in medical ethics really do happen in our own lives. I have an extended family member, and he's not doing as well right now. And it was really nice to talk about some of the issues some of the questions about like DTRs, personal autonomy, and caretaking. It was nice to talk about those in a detached classroom setting before approaching them as just in a more personal way.
I loved studying medical ethics because I was able to bring philosophy into just a practical domain. We were able to discuss and think about and consider things that actually mattered. Not that other philosophy doesn't do that, but medical ethics does it to an extreme extent. Everyone's going to deal with the things that you're going to deal with in medical ethics. Everyone's going to know people who get an abortion or people that want to deal with patient-assisted suicide or just limited resources in healthcare.
Medical ethics is great preparation for med school, law school, and life. For more on this, let's go again to Kai Lavelle, and then we'll hear from Travis Norseth. We'll hear again from Madison Harmer and from Michael Morgan.
That was really helpful in my medical school interviews I just had. I think my medical ethics class prepared me more for those interviews than any class I've had. And so, also, I feel like this medical ethics class that I took will help me become a better physician, help me just consider the important values that intersect in difficult ethical situations, like the autonomy of the patient or the well-being of the patient. Lots of times those will conflict, and I'll be able to think about them in a more intelligent manner now that I've taken medical ethics. And I think it'll help everyone just become a better human being and better at applying philosophical, logical reasoning to practical issues.
So I think that studying medical ethics at BU gave me a really good foundation upon which to build during my first few years of medical school. Having some familiarity with the hard topics that we would be discussing with real-life patients, and to be able to be a leader within my class, having already thought and discussed some of these important topics, has really been a great benefit to me. And
studying medical ethics is critical for anyone who wants to go into the medical field. I've been applying to medical school, and my study of medical ethics has really helped me in answering essay questions and interview questions, and I know that I'll be a better doctor because of my background in medical ethics.
If you're planning on going to law school especially, I think it's really a great introduction to the theories behind a lot of the laws that we have in society. The theories like distributive justice or commodification of the human body and libertarianism. And these are issues that you talk about medical ethics, and these are issues that you'll talk about also in law school.
In short, medical ethics is a great class. I hope to see you in Philosophy 212 next semester.